Okay, we're starting now.
Thank you. Good afternoon, colleagues. Welcome to our August meeting of the Newport City Council Cabinet. I'd just like to start this meeting by welcoming Beverly Owen here, joining us today in her role as our new Chief Executive. I know, Beverly, you've been with us many times before in your previous roles, but welcome as our Chief Executive. It's great to have you here with us today. So we start with item 1 on our agenda. Apologies, we haven't received any so far. We move on to item 2, declarations of interest. Has anybody got any declarations of interest? No? Thank you. So we move swiftly on then to item number 3 on our agenda today, which are our minutes from the July Cabinet. You'll find these on pages 3 to 16 of your packs, and you will have had an opportunity to go through these. Are members content that these are a true record of our previous Cabinet meeting? Yep. And members happy to approve that? Yeah, have we got somebody to first and second it? Great. Everyone in favour? Thank you very much for that. We move then to item number 4 on our agenda, which is the reason why we've called this special Cabinet meeting today, and that's to consider the business case for the Test, Trace and Protect service. And you'll find the report for this on pages 17 to 54 of your packs. As you know, this is essential in terms of the ongoing fight against COVID. And in June, Cabinet received an interim report on the work that had been undertaken to establish a local contact tracing team in Newport. You will recall, colleagues, that we endorsed the urgent action and approach taken by officers to develop and implement that temporary service. That report, as you recall, recognises that these were just interim arrangements for the first few months in order to get that service operational in an extremely short timescale. And I would like to acknowledge the work done by all of our officers in order to enable that and facilitate that. That was an outstanding piece of work. At that time, it was recognised that a future strategy would need to be agreed in conjunction with our other partners to develop a delivery model and governance structure for the longer term. Welsh Government funding for the service was critical, as this could not be delivered within existing resources. So the report we have before us provides an update on developments with the Gwent contact tracing service and seeks Cabinet approval of the proposed operational delivery structure, governance and finance arrangements for the service. The Welsh Government's Test, Trace, Protect strategy forms a central part of their COVID-19 recovery plan. Community contact tracing is a key element of the strategy, and Welsh Government have asked local authorities and health boards jointly to put in place contact tracing services based on health board footprints. Contact tracing is carried out on receipt of a confirmed COVID-19 diagnosis, a positive test result. The purpose is to contact somebody who's tested positive to confirm that they must isolate for 7 days and that their household also needs to isolate for 14 days. The contact tracer will also ask the case to share information about their recent contacts. These contacts are traced and informed that they must isolate for 14 days. During this time, daily contact will be established to monitor whether they develop any symptoms. If they do, they are asked to get tested and enter the system as a new case, and so on. Now, contact tracing has been undertaken in Gwent since the beginning of June by redeployed staff within the 5 local authorities and the Aneurin and Bevan University Health Board. All 5 local authorities have set up contact tracing services, which are operating in a coordinated way in order to ensure that we have coverage across the region. The service operates 7 days a week, and the Council's contact tracing team is supported by local authority environmental health officers across the region, and by clinical leads, consultants in health protection, and consultants in communicable disease from Aneurin Bevan University Health Board and Public Health Wales. I'm pleased to say that Welsh Government have now confirmed funding arrangements for contact tracing, and our Cabinet report sets out proposals for the next phase of the Gwent contact tracing service, moving from a redeployed workforce to a fully employed model in order to ensure that there is capacity for successful delivery. The total grant funding of up to 9.6 million has been allocated for the cost of the service up until the 31st of March 2021, and an additional £200,000 has been allocated for the capital costs of IT equipment. A costed workforce model has been developed for Newport, submitted and agreed by Welsh Government, and should numbers of employees be recruited as set out in the model, the cost to Newport covered by the funding would be around 1.7 million by the end of March 2021. The available grant funding also includes funding for an additional environmental health officer to bolster the environmental health resources to respond to COVID-19 incidents, clusters and outbreaks in accordance with existing statutory duties regarding contagious and infectious diseases. A partnership model to deliver the Gwent contact tracing service is proposed. Each organisation will have clear roles and responsibilities as outlined in the business case, which forms the appendix to our Cabinet report, and this will be formalised through a memorandum of understanding. The business case, colleagues, as I'm sure you've considered already, contains the terms of reference of the various tiers of the service. The strategic board will be the G10 partners. It's proposed that Torfaen County Borough Council become the host and lead organisation for the Project Management Office, which will support and ensure the effective delivery of the service across the organisations involved in the partnership. The role of the Project Management Office is set out full in our report. Aneurin Bevan University Health Board will act as the financial lead. They will distribute the funding to each local authority to reimburse them for the costs of the local teams. And this is very similar to the current ICF arrangements that we have in place. A great deal has been achieved to establish the Gwent contact tracing service in such a short space of time. Our report sets out proposals for the next phase and demonstrates the central role that local authorities have in responding to the COVID-19 pandemic. And I can't emphasise that enough, colleagues. You know, the role of the local authority is key to this. And as we move out of lockdown, contact tracing is an integral part of managing and providing intelligence and data on cases and outbreaks within our communities. It's essential that Newport City Council plays its part in delivering the Gwent service that will assist Newport, the Gwent region and Wales to stay out of lockdown and in time to recover from the pandemic. The G10 group agreed to these proposals at their meeting on the 29th of June 2020, and the partner Gwent local authorities have decided that a formal decision is required now to give their approval. This is why we have the paper before us today, colleagues, and we're asked as the Cabinet of Newport City Council to formally agree these proposals. If we're minded to agree the principles set out in the business case, then it is recommended that the final sign-off of the Memorandum of Understanding should be delegated to officers, together with any minor changes in to the final business case, provided that this is in accordance with the terms approved by the Cabinet. I can't emphasise enough, colleagues, how important this particular action is This is really sets the scene for us moving forward, and it's really key to us protecting all of our residents here in Newport. And at this stage, I'd just like to open this up to any comments from members, and I'll start by inviting the Cabinet Member, Councillor Truman, to comment. Councillor Truman.
Thank you, Leader. Leader, in June, the report states that we set up an interim contact tracing service, which we have with 5 other local authorities and the United Bevan Health Board. But a lot of staff have redeployed onto the service, and some volunteers as well. And we gained a considerable amount of experience, know-how, knowledge, and certainly using the data from that to set it up. But I think I must at this stage give a big, massive thanks to all the staff that have worked with this, because they've been under tremendous pressure, particularly the trade standards officers and the environmental officers, because they were heavily involved with lockdown, and then they had to take on the role with others of setting up a contact tracing service. So they've done a considerable amount of work, and all of them stepped up to the plate and did a fantastic job. I have to say that, Leader. But Leader, as we move from a formalised contact tracing service, sorry, an informal contact tracing service to a formalised one, we've got to scale up now, because those who are redeployed on that service will go back to their substantive jobs, and we'll have to employ for additional people, and training will be given. But we've gained a lot of knowledge for using the informal system. But for me, communication is vital for this to succeed. Communication, that's the most important thing. Now, the report does recognise this, and it states in there, and that's just a couple of things I want to bring out from it. It says, the report recognises the challenges set out on communication. For some individuals, contacting them could be difficult. For example, people with health problems, people with language barriers, and lack of access to IT facilities. But so what they've done, they've worked up a protocol which has been developed, linking testing and tracing teams with networks in the community who have the local knowledge to assist the contacts. Also, there is local knowledge towards a translation service that may be used, which for people who haven't got English for their first language. That apparently is being used already in Gwent, and it's very successful. So for me, once again, massive thank you for all the staff and all the work's being done. But communication is the key. Communication is the biggie. And as I say, with that local knowledge and networks we can use and have already been used, that is vital to me in this being a success. Thank you, Leader.
Thank you. Thank you, Councillor Truman. I'd just like to add that I fully support and echo your comments. And can I also give my thanks and the thanks of Cabinet colleagues to the diligent way that you've approached this in your role as the Cabinet Member, and the leadership that you've shown. And I'm sure the officers, you know, are very grateful for the support that you've given them during this period. So thank you very much for everything that you've contributed to this. Councillor Harvey.
Thank you, Leader. I just want to echo, it's been a job well done. We are a thriving city, and our well-being objective is to enable people to be healthy, independent and resilient. And without this, we're not going to be. It's as simple as that. People think COVID is done now, it's gone, we've hit the peak and off it's gone. It isn't. It is far from over. And without this test, track and protect, I think it'll be absolutely enormous if we don't keep a handle on things. I take my hat off to everyone involved. They really have gone above and beyond. We say it every time we have a cabinet meeting, but we can't say it enough. The staff have been incredible. They've done everything and then some, to be perfectly honest with you. And for me, this is an absolute, it's a must, it's essential, and we have to take it on board. Thank you.
Thank you, Councillor Harvey. Councillor Rahman.
Thank you, Leader. I just want to also echo your thanks to the Cabinet Member Ray Truman for his leadership in this, and I want to point out how much that this council has done to support the government, but also support our country, and not just our local residents. Across Wales, we've seen everyone coming together, and it's no different for Newport City Council to come together with other Gwent authorities to tackle this pandemic. I just want to point out and raise in the report, you'll see how much resources this authority has put in, not just in staffing levels. We are losing staff to help our residents across Newport, but also across South Wales and the Gwent area, but also giving up office spaces and assets as well, which obviously comes under my portfolio. But I also want to mention the work we're doing with the Welsh Government, because it is because of the funding that they put in place that we're able to have the success that we're having currently in the Gwent area. They've committed another £32 million to speed up results turnaround times. 6 new hot labs are being created, and extra staff are being recruited as well for Public Health Wales, which means that those that do test positive for COVID-19, hopefully they can get a quick result and get treated as soon as possible, which goes to show that in Wales, we are keeping on top of this pandemic. If you look at the figures speak for themselves. NHS Wales Test, Trace, Protect results, 90% of COVID contacts have been reached, 90%. I'm not even sure England are close to that, to be honest with you. But here in Wales, we are one of the leading nations, home nations, in tackling this pandemic. And it goes to show that not in Wales, we don't have localized lockdowns and touch wood, we don't have that. So I just wanted to say, Leader, thank you to the Cabinet Member. Also thank you to you and the authority for taking the lead on this and working with other authorities, and making sure that we're not just protecting our residents but our nation as well. Thank you, Leader.
Thank you, Councillor Rahman. Councillor Giles.
Yeah, thank you, Leader. It certainly has been fantastic work by yourself, Councillor Truman, and all the officers, and a huge amount of work, I'd imagine. I haven't been personally involved in all of it, but it's really must have been very intense and are ongoing, of course. But it's reiterating what's been said already, of course. I mean, Councillor Truman's comments about communication, absolutely, totally. It's getting that message across. And it's the most important way to identify and control early outbreaks, as well as historical occurrences. This is the information we're going to find, isn't it? And it's reminding people that you may be symptomatic, but you may be asymptomatic. There may be no symptoms. And unless these tests are undertaken, people are not going to know whether they've had it, whether they're going to have it, or have it at the moment, rather. So local identification, working within our Gwent district with the other organisations is really good news, and it's the most effective way to do things, of course, isn't it? And we've seen in other areas where there has been poor track and tracing. We're seeing elsewhere, aren't we, about now further lockdowns, as alluded to earlier on, and outbreaks occurring. So I think it's a really very positive way forward. It's the right way forward, and will be the most effective for assisting our residents. Yeah.
Thank you, Councillor Giles. Thank you. Councillor Mayer.
Thank you, Leader. I want to repeat all the congratulations you've been given by the rest of the team for the work you and Ray have been doing on this. That's a given for me. That's what you do really well, and that's why we get such good results. What I would like us to say, which I always do, a bit like a worn record here, and that is that I spoke to Sean Powell at the beginning of this epidemic, and I asked him about contact tracing long before. What are we talking? 3 months later now, we're getting this implemented, and and he agreed that, you know, with the technology that we have in the intelligence hub, we could do that. We could find out not just who has been infected, but a whole host of geo mapping information that shows the spread of the virus through communities, through cities, through Wales. So it's fantastic that we've got the technology here, and now we've got an opportunity to put it to really, really good and effective service here. So I really welcome this, and I hope that everybody else in the authority eventually buys in to the concept of the intelligence hub and the sharing and the geo mapping of data, because, you know, that this in future something will happen and we will have everything right at our fingertips just by looking at the data. So thank you, Linda.
Thank you, Councillor Mayor. Thank you for that. Deputy Leader.
Yeah, thank you, Leader. Yes, I'm going to echo the comments and thanks as well to yourself and Councillor Truman and the statistics that Majid gave us. I think Gail said the most prominent word there of control over this. I think that's vital. It's a very important link in the fight against COVID and the increase, because realistically, lockdowns, local lockdowns, don't do the economy, don't do anybody any good against well-being. So we need to steer clear of that at all costs. I just wanted to ask quite simply that the training that will take place with these newly appointed. Where is that likely to? Obviously, that will be virtual, but is that likely to take place in each authority, or will it be a big link for everybody? It was just a question, really.
Chief Executive, would you like to give some more detail on that?
Do you want me to answer that, Beth? Sorry.
I was going to say, Gareth is they're covering it, but
on the training, Roger, because they're each local teams, then each council will be responsible for its own training. But we've developed training modules with the other councils and with Public Health Wales so that the training that's being delivered is consistent across the board.
Excellent.
Because we do recognise that even though we'll be providing this on a local area basis, there will need to be some cooperation in terms of cross-border work, depending on the levels of testing in each of the areas. So there will be that joint working arrangement, and therefore the training needs to be consistent across the board. But we will deliver the local training for our staff here. Just on that point, I mean, just by interest, we've had over 300 applications for the contact tracer and contact advisor jobs. Yeah. So we're pouring through those applications now. We're also working with partners such as Newport Live to see if they've got any furloughed staff or under-deployed staff that could be transferred into this service for the next 9 months. So we're working with other partners to look at redeployment opportunities there. So we're hopeful going forward that we can recruit the full staffing complement and that they will be fully and properly trained.
Thanks, Gareth. I think that just proves from those sort of numbers how important people feel about it. And you know, let's get that done and get it on board. Absolutely vital. Thank you very much.
Thank you.
Yeah. So thank you, colleagues, for your contributions. I think we've had a very helpful discussion on that particular item today. Clearly, we all agree of the importance of this, and certainly the importance in terms of protecting the population as we move forward. So can I ask now for members to show their support for this by voting using the electronic voting system that we have here today. And if the system isn't showing for you, please just raise your hand. Okay, that's great. Thank you very much for that. Thank you, colleagues, for your support for that item, and that's one step closer, isn't it, to keeping the people of Newport safe. So thank you very much for your consideration of that. We move on then to the last item on our agenda, which is the Cabinet Work Programme. This is on pages 55 to 58 of our report. As you can see from this is our regular monthly report on the work programme, and certainly the proposed agenda for our September meeting reflects the fact that a number of reports were delayed in terms of coming through this process during the pandemic period. So there's quite a hefty agenda for our September meeting, and I'm sure we'll look forward to going through that in more detail next month. So colleagues, happy with that? Yeah, everyone happy? Okay, thank you very much. And that brings us to the end of our agenda for today. So thank you, colleagues, very much for your comments, for your considerations of our report. And I'd really like to thank all of our officers on the call. And just as the Cabinet member has already mentioned, you know, the work that has been done by our public protection teams across the local authority during this period has been absolutely outstanding, really has, and they do deserve that recognition for the work that they've done. They truly reflect the real values of public service, so thank you to everyone for that, and thank you colleagues for your engagement today, and I draw this meeting to a close. Thank you.